you see the treatment of the megaloblastic anemia, for the treatment of megaloblastic anemia, we give this vitamin B12. So what will be the route of administration of vitamin B12? This vitamin B12, it can be given via intramuscular route or subcutaneous route, or it can be given just in the form of, that is, oral formulations. Now which particular form of megaloblastic anemia require intramuscular or subcutaneous administration? We have a form of megaloblastic anemia, or we have a form of B12 deficiency anemia, that is called pernicious anemia. Right, that is called as the pernicious anemia. So pernicious anemia, it is due to deficiency of intrinsic factor, right? And this pernicious anemia, this is an autoimmune condition. Right, pernicious anemia, it's an autoimmune condition where the antibodies, they are formed against the parietal cells. Right, where the antibodies, they are formed against the parietal cells. Now these antibodies which are formed against the parietal cells, they will cause the destruction of the parietal cells. Right, they will cause the destruction of the parietal cells. Okay, so once the parietal cells are not formed, there is decreased synthesis of intrinsic factor. So when there is decreased synthesis of intrinsic factor, the transportation of vitamin B12 from the stomach to the terminal ileum does not occur, and that particular type of anemia is your pernicious anemia. So in pernicious anemia, you should not give the oral formulation of vitamin B12, because in pernicious anemia you don't have intrinsic factor for the carrying of vitamin B12 up to the level of your terminal ileum. So that is the reason why in pernicious anemia the vitamin B12 has to be submitted or administered either through subcutaneous route or through the intramuscular route. Whereas the other forms of the megaloblastic anemia, that is dietary deficiency of vitamin B12 deficiency, in such case you can give the oral formulations of vitamin B12. Next, this vitamin B12, it is also required for correcting neurological abnormalities in diabetics, right? So one is, it is used in the treatment of megaloblastic anemia, and the next thing is, it is used for the treatment of neurological abnormalities right, for the treatment of neurological abnormalities in diabetic patients. Okay, so here which formulation of vitamin B12 is used? Methylcobalamin is used. Right, which formulation of vitamin B12 is used? Methylcobalamin is used. And this vitamin B12, it is also used for the treatment of tobacco amblyopia. Right, also used for the treatment of tobacco amblyopia. And which formulation of vitamin B12 is used? Hydroxocobalamin is used. Right, hydroxocobalamin is used. Now this hydroxocobalamin which is used, it combines with the cyanide to form cyanocobalamin. Right, this combines with cyanide to form cyanocobalamin. Now if the cause of megaloblastic anemia is not known, see this megaloblastic anemia, it could be due to folic acid deficiency or it could be due to vitamin B12 deficiency. If the cause of megaloblastic anemia is not known, folic acid alone should not be given, because if you are giving folic acid, it will correct the blood picture of the anemia, but neurological deficits due to vitamin B12 deficiency, they are not corrected by your folic acid. Okay, so if the cause of if the cause of megaloblastic anemia, if it is not known, if the cause of the megaloblastic anemia, if it is not known, you should give both, you should give both folic acid and as well as vitamin B12. Okay, so because just only supplementing folic acid, it will correct megaloblastic anemia, but it will not correct the neurological manifestations which will appear due to vitamin B12 deficiency. So that is the reason why you need to give both vitamin B12 and as well as folic acid whenever there is megaloblastic anemia. Or in fact, if you are just giving only folic acid in megaloblastic anemia and if it is due to vitamin B12 deficiency, this will further aggravate the neurological deficits. This will further aggravate the neurological deficit. Why? Due to diversion of small amount of vitamin B12 which is left in correcting anemia instead of utilization in the myelin formation. Okay, so the point is that if there is megaloblastic anemia, give both folic acid and vitamin B12, not just only folic acid. Now, what are the causes of this megaloblastic anemia? So until now, like we have discussed, what do you mean by this megaloblastic anemia and all? Megaloblastic anemia is that like where the size of the RBC are enlarged. Actually, vitamin B12 and as well as folic acid, they are required for maturation of the RBC. They are required for the DNA formation within the RBC. If there is vitamin B12 deficiency or folic acid deficiency, the RBCs like what you have is the immature RBCs where you have the presence of the megaloblasts, where you have the presence of the megaloblasts. Now, what are the other causes of vitamin B12 deficiency or other causes of megaloblastic anemia apart from B12 deficiency and folic acid deficiency? Let me discuss what are the various causes of megaloblastic anemia. So before that, please remember vitamin B12, it is required for the treatment of megaloblastic anemia, pernicious anemia, but in pernicious anemia the route of administration of vitamin B12 is intramuscular or subcutaneous route. Then this vitamin B12, it is also required for the treatment of the neurological abnormalities in diabetes mellitus, and it is also used for the toxic amblyoppias. And if the cause of megaloblastic anemia is not known, then you need to give both folic acid and as well as vitamin B12. Now let me just give you a mnemonic for what are the causes of the megaloblastic anemia. So let me take up the discussion on what are the causes of megaloblastic anemia. So for this we have a mnemonic, that is prime we have a mnemonic, that is prime batsman. Now what does this prime stands for? P is your phenytoin and as well as primidone. So what is this phenytoin? It is an anti-epileptic drug, and this phenytoin, it can be given in both your focal epilepsy and as well as generalized tonic-clonic epilepsy, that is GTCS. And this phenytoin toxicity, it is associated with the development of the megaloblastic anemia, and this phenytoin toxicity, it will cause both folic acid deficiency and as well as vitamin B12 deficiency, and that can make the individual to develop this megaloblastic anemia. And the another important P is your primidone. Primidone is also an anti-epileptic drug. Now there is one common thing between these two drugs, primidone and as well as the phenytoin. Apart from megaloblastic anemia, which is common for both, this phenytoin and as well as primidone toxicity, it is also associated with the development of lymphadenopathy, where it is characterized by enlargement of the lymph nodes. right, where it is characterized by the enlargement of the lymph nodes. So these are the two common things for your phenytoin and as well as primidone. Both of them are anti-epileptics. Both of their toxicity can cause megaloblastic anemia, and both of their toxicity will also cause the development of the lymphadenopathy. Now, the other causes of megaloblastic anemia is your B. B stands for B12 and as well as the folic acid deficiency. Right, as already I have said you, both of these deficiencies can cause the megaloblastic anemia. But how will you differentiate? The add-on point is that in case of vitamin B12 deficiency, you have the neurological manifestations. Let me just sum up what are all the neurological manifestations that you will have in B12 deficiency. Neurological manifestations that you will have is number one, subacute combined degeneration of the spinal cord, right? And there will be also development of the peripheral neuropathy, and in case of vitamin B12 deficiency, let me also tell you the cranial nerves are also affected, right? And the important cranial nerves which are affected is the optic nerve and as well as to certain extent even the facial nerve. Okay, but optic nerve, right, very important, that gets affected whenever there is vitamin B12 deficiency. And not only that, this vitamin B12 deficiency will also cause the mental changes, and these particular mental changes that includes defective cognition, there can be development of seizures, and there can be also development of dementia due to vitamin B12 deficiency. So these are the neurological manifestations that you can have in case of vitamin B12 deficiency. So B12 and folic acid deficiency will cause megaloblastic anemia, but only B12 deficiency will cause neurological manifestations. And why is that? Because vitamin B12, it is required for the formation of the myelin sheath around the axons. Now, the other important cause for megaloblastic anemia, A stands for alcohol intoxication. Right, alcohol intoxication. So in case of this alcohol intoxication, you have multiple deficiencies. You can have thiamine deficiency. Even the individual will suffer with the hypoglycemia. So these are all the manifestations that you will have in the alcohol intoxication. Then you take this word T, that is trimethoprim. Now what is this trimethoprim? Trimethoprim is an antibiotic, and this trimethoprim plus sulfamethoxazole, right, trimethoprim and sulfamethoxazole, these two together we call it as cotrimoxazole. Right, these two together we call it as the cotrimoxazole. So this particular trimethoprim and sulfamethoxazole, which is the cotrimoxazole, right, it is used in multiple conditions. Like for example, you take in HIV for the treatment of PCP pneumonia, that is for the treatment of Pneumocystis carinii pneumonia or Pneumocystis jirovecii pneumonia. What will be the drug of choice? Drug of choice is your cotrimoxazole. So what is this cotrimoxazole? Trimethoprim plus sulfamethoxazole, right? And out of this trimethoprim is the one which will cause the megaloblastic anemia. Then you take this word, S stands for sulfasalazine. So, right, sulfasalazine, it is a sulfa group of drugs, and where is this sulfasalazine used? This sulfasalazine, it is used in the treatment of the rheumatoid arthritis. See, in the treatment of rheumatoid arthritis, we have the non-biological agents and as well as the biological agents. What are the examples of your non-biological agent? That is your sulfasalazine. Sulfasalazine is a non-biological agent, right? And what are the other non-biological agents? That includes methotrexate, leflunomide, hydroxychloroquine, and then minocycline, and then gold salts. These are non-biological agents. So your sulfasalazine, which is used in the treatment of rheumatoid arthritis, can cause the megaloblastic anemia. And apart from non-biologicals, like you also have the biological agents, right? You also have the biological agents used in the treatment of the megaloblastic anemia. And this particular biological agents, right? This particular biological agents, they include TNF alpha inhibitors, right? Then anakinra, satralizumab. These are all your biological agents. Okay. Then if you take this M, this stands for metformin. right? M stands for metformin. So what is this metformin? Metformin, it is a bigonide, right? Metformin, it is bigonide. So metformin, which is a bigonide, it is used in the treatment of type 2 diabetes mellitus, right? Used in the treatment of type 2 diabetes mellitus, and it is a oral hypoglycemic agent. And in type 2 diabetes mellitus, if you consider, or if the question is asked, what is the drug of choice? The drug of choice in case of type 2 diabetes mellitus is metformin. Why? Because metformin has multiple advantages. Metformin will never cause hypoglycemia, right? Metformin will also cause weight loss. Metformin will cause maximum reduction in the HbA1c. So that is the reason why metformin is considered as drug of choice in type 2 diabetes mellitus, and this metformin is associated with the vitamin B12 deficiency, right? Metformin, there are many other adverse effects. It will also cause gastritis, it will also cause metallic, it also causes the development of metallic taste, right? And this particular metformin toxicity is also associated with the development of the lactic acidosis. See, metformin you should not give in patients with the chronic renal failure. Why? Because if you give metformin in chronic renal failure, the development of lactic acidosis, it get precipitated or it get increased. That is what you will see in the metformin toxicity. Next, now the word A, we have certain antifolates which will cause the megaloblastic anemia. And what are these antifolates which will cause megaloblastic anemia? That includes number 1, methotrexate. Methotrexate, just now I was discussing, it is a non-biological agent used in the treatment of the rheumatoid arthritis, and this methotrexate, it is a folate antagonist. So methotrexate has to be given once in a week, and remaining 6 days we should give this folinic acid or leucovorin, right? And other examples of your antifolates, they include pyrimethamine, right? Pyrimethamine, and another very important drug is proguanil, right? Other important drug is proguanil. So these are the antifolates: methotrexate, pyrimethamine, and as well as proguanil. So whenever you are giving these drugs, definitely you need to supplement the folic acid. And the word N stands for nitric oxide. So these are the causes for the megaloblastic anemia. So the mnemonic is prime batsman. So P stands for phenytoin and as well as primidone. B stands for B12 and folic acid deficiency. A is your alcohol intoxication. T is your trimethoprim, which is an antibiotic. S is sulfasalazine, used in the treatment of rheumatoid arthritis. M is your metformin, used in the treatment of type 2 diabetes mellitus. A stands for antifolates, like for example methotrexate, pyrimethamine and proguanil. N stands for the nitric oxide. So these are the causes for megaloblastic anemia. So with this, we are done with the topic of the hematinics, in which I have discussed about the iron, folic acid and as well as vitamin B12.